Thank you all. We're going to move now to a paper on workforce, and I am very grateful to Eirini-Christina Saloniki and Shereen Hussein, who are going to present a paper, and this is a hard-hitting title, I think very honest, on the abuse and well-being of long-term care workers in the COVID era, evidence from the UK. Thank you very much.
Thank you so much, Adelina, and everyone for this great conference. Really, a couple of days conference, Adelina, turned out to be very timely. So today, Eirini and myself are going to present some findings from a recent survey. I'm going to just introduce the study, then Eirini is going to talk about the results, and then I will provide the conclusion, and we'll try to keep on time. So the reason we're calling it this title, because when we initially put the survey, it was about understanding the experience of the workforce. And what came from the experience was unfortunately a huge level of abuse and deterioration in the well-being, not only in the kind of working conditions, but the well-being of workers in different aspects of their lives. So the study is, this study is part of a bigger study called Retention and Sustainability of the Social Care Workforce, or the Rescue Project, which is funded by the Health Foundation in England, and it started in 2019, just before the pandemic. It was to help really before the pandemic. We knew that there was huge shortages and issues around staff retention. And that was the main purpose of the project, and we have different work packages. Then we extended the work when the pandemic happened. We were very lucky that the Health Foundation approved extra funding to look more specifically on the impact of COVID-19 on the workforce. And we are a group, of researchers from different universities at the University of Kent, London School of Hygiene, UCL, Bayes School, and also partners in the field, Skills for Care in particular. So I will talk now about the C19 Work Package, which started in March 2020, after we started the project in end of 2019. So we obtained extra funding, which allowed us to start with kind of media policy analysis and drafting and piloting what we call then a pulse survey, which is a quick survey to get a feeling of what is going on with the workforce. There was a lot of anecdotes and a lot of media news. And we conducted in July to August 2020, as I said, the pulse survey was the aim to get around 300 responses, and we got almost exactly that number of UK frontline care workers. We've kind of written about it, but also took the findings and did qualitative interviews with kind of a top-down perspective on the findings with 6 social care stakeholders. And then we did analysis, and then we designed a 2-wave longitudinal survey. And we're going to talk today about the findings of the first wave. And the second wave is actually open now. So please help us distribute the link to get more people, and retweet when we're going to be tweeting soon to get more responses. And in April and June, we launched the first wave of the longitudinal survey, and we got over 1,000 respondents from the UK and approximately 500 respondents from America, which was really interesting. And we're still kind of thinking what to do with these figures, but we've got this kind of data. And then we continue to do kind of the analysis and engagement and recruitment, and part of what we're doing today is the engagement. And in November, we launched the second wave, which will continue being open until the beginning of next year to collect more responses. So I'm going to hand over, so today, Eirini is going to talk and I'm going to talk about the wave 1 results, and I'm going to hand over to Eirini to tell us about a bit of details on the findings. Eirini?
Thank you, Shereen. So yes, thank you, Adelina, for the invite. The wave 1 the survey, the first wave, ran between April and June in 2021, and as Shereen mentioned, we received a bit over 1,000 responses that were valid. So our respondents were predominantly females, and 3 out of 10 were aged between 45 and 54. We got a bit over 70% were white British, and their main place of work was in England. However, we did manage to capture respondents working in other countries as well. As you can see, we got about 10% from Scotland. Our respondents were quite experienced, and this is consistent with what we saw in the Pulse survey. They had over 10 years of experience of working in the social care sector. They were mostly employed in contracts with guaranteed hours, and over half of them were from the private sector. We had a question about whether they were or are currently a member of a union, and a bit over half of them responded with a yes to that. Next slide, please. So our respondents were mostly direct care workers, and as you can see, a bit over 70% of those who responded positively to the survey. We had about 2 out of 10 were employed in managerial roles, but we also managed to capture a few personal assistants and living care workers. The majority of our respondents worked with older adults, and a bit of a surprise, I suppose, we didn't quite expect that. We did get a few respondents who worked with children and young people. This is a category that we did not include in the Pulse survey, but it emerged in this wave. As you can see, in terms of the setting, we have almost half and half split between residential and domiciliary care, and we managed to get some respondents from supported or extra care housing, and also community services or daycare centers. We had a question about whether since the beginning of the year of 2021, the workers experienced several different incidences. So here we are focusing only on the most frequent ones. And as you can see, workload, increased workload, in particular with no additional pay, is quite high in the list. Over 3 out of 10 responded to that. And then obviously, as you would expect at that time of the interview, of the survey, quite a few of them also self-isolated. Increased paid working hours also was quite high, and also there were instances of several days of sick leave due to COVID-19, or even not related to the virus. About half of them, if they did self-isolate, they took some sick leave or stopped working, did receive normal pay. However, as you can see from the quotes, because we had some pretext responses, really the issues of high increased workload and low pay were quite prevalent in the quotes, and reflecting, I suppose, the climate at that time, and also the feelings of the respondents. Next slide, please. So we were quite interested in terms of the COVID prevalence. Again, our reference point is the start of 2021, and also whether the respondents had at that point in time the first dose of the vaccine. So as you can see, we had about 7 out of 10 who did confirm that they had COVID-19 cases among their staff or clients in their working environments. The respondents were quite keen to say whether they had the first dose of the vaccine. The vast majority did, but we also got a small percentage that didn't want to disclose whether they did have it or not. In the quotes, the feeling you can grasp is really we get both sides. So some respondents were quite happy to be offered and have taken the vaccine, but also there were others who felt pressure that they were sort of obliged to take the vaccine. And here, I suppose the question that arises is, yes, what is current situation with the mandation of the vaccine? What is there a link? Can we really tell something? And we, in fact, included a question about the vaccine mandation in wave 2. So that will allow us to make some comparisons and look at relevant relationships. Moving on, I suppose, to the juicy part of this presentation is about abuse. So we had a question about whether the respondents experienced any type of abuse, and by any type we were quite specific in terms of verbal abuse, bullying, threat to physical violence. We provided some brief definitions for each of these types of abuse, so respondents were able to identify what we mean by that. As you can see, 26% of them responded having experienced at least one type of abuse. Verbal abuse and bullying came quite high in the responses, 20% for verbal abuse and a bit over 10% for bullying. I suppose it's not quite a surprise that verbal abuse is quite high in the list. From the literature we are aware, I mean, in the pre-pandemic era, verbal abuse was one of the most common types of abuse reported in the sector, especially with regards to the service users and the family of the service users. And this links nicely with this last bit of this slide, which talks about the sources of the abuse. Again, we focus on the two most prevalent types of abuse. And as you can see, about 45% reported being verbally abused by the service user or client, and 32% by the service user's or client's family. We do have some reportings of abuse by colleagues, the general public, or the manager, supervisor as well. For bullying, the picture is slightly different, but still colleagues, managers, supervisors come quite high in terms of the perpetrators, if you like. And service user is also within the top 3 perpetrators in terms of bullying. Next slide, please. So we were not just interested in the type of abuse and the perpetrators, but also whether the respondents took any action to deal with this abuse. For verbal abuse, as you can see, almost half of them did report it to a manager or supervisor. There were some who didn't take any action, and that might come as a surprise. But as you can see from some of the quotes on the right, in some cases, it might have not been safe for them to seek help or take any action, given the setting they were working in. But it might have been that they reported it to the management, but there was nothing else outside of that. In terms of bullying, again, it was reported to the managers, but there was a small percentage who also tried to seek help from the union. Next slide, please. We were quite interested to see if there are any differences in abuse in terms of nationality and ethnicity or care setting. And as you can see, we did get those, specifically respondents from a BAME, so Black, Asian, minority or ethnic backgrounds were more likely to experience abuse than white non-British and white British. The difference was statistically significant only when we compared the BAME and white British group. For care setting, again, we found a significant difference in terms of abuse between the two settings. Those working in residential care were more likely to experience some form of abuse compared to those in the domiciliary care or other settings. And again, that is not quite surprising. We did not find any differences when we looked at the different countries. Work-life balance, health and well-being. Yes, we wanted to see what workers felt about their working environments. You can see that over half of them were satisfied or very satisfied with their work-life balance. There were some issues with workload, and we can see that 4 out of 10 almost reported that in the past few weeks, their job has made them feel almost or all of the time tense, uneasy, or worried. General health, they did quite well in the sense that about half of them reported excellent or very good health in our survey. Right, so the other thing we were quite interested to see is how abuse or whether abuse, the different types of abuse determine well-being. Well-being measured in 2 ways. In our case, we used a proxy that was a composite index created from the feelings questions that you saw in the previous slide, and also work-life balance as an alternative indicator. What you can see and you would expect is that abuse negatively impacts on well-being, and you can see this from all the negative signs in the coefficients from some linear estimations that we are reporting here. Something I did not mention, but there is a note underneath the table, is that we controlled for several variables, including age, care setting, employer type, some regional statistics on cases and COVID-19 deaths, demographics, contract type, and so on. What is interesting to see is the magnitude of these coefficients when you're looking at the abuse count and the abuse type. You can see that the coefficient for multiple abuse, meaning that several types of abuse, is much larger than single abuse, and that is again supposed to be expected. The more severe the abuse, the higher is the impact on well-being. Interestingly, in terms of the abuse type, I would say that bullying and physical violence for the proxy have the strongest magnitude, and that seems to be the case also when we are looking at work-life balance as an indicator of well-being. And in both estimations, the coefficients seem to be highly statistically significant, at least at 5% level. Next slide, please. Our last topic from these results is really around some job attitudes and intention to quit, because we were interested to see whether the workers, considering everything that they are going through and the circumstances in their working environment, were more likely to leave their employer or even the sector altogether, specifically in the next 12 months. And as you can see, we have almost, well, I would say about 45% of our respondents said that they are very or quite likely to leave their current employer voluntarily in the next year. And that figure went down to about 30% for the sector altogether. These are quite concerning figures, are quite high, and it's something to pinpoint here. Also from the top pie charts, donuts, you can see that again, the satisfaction with job overall seems to be quite high, despite the issues, I suppose, with pay and limited promotion prospects. And these are again reflected quite significantly in some of the quotes that we have included here in the slide. So the final set of findings here, again, we wanted to see how abuse impacts on intention to leave either the employer or the sector. We ran some linear estimations with, again, controlling for several characteristics as with the previous findings. either socio-demographic characteristics or more work-related factors such as contract type, tenure, job role, and so on. And what you would expect is that the more you experience abuse, the more likely that is going to impact on your willingness to leave the sector or even your current employer. And this is what we see. All of those coefficients have a positive sign. So, for example, when you're looking at the count, again, you can see that irrespectively of whether you have been experienced only one type of abuse or multiple types of abuse, that is going to increase the likelihood of you wanting to leave the employer or the sector. In terms of the type of abuse, again, looking a bit more into the magnitude of these coefficients and which one prevails, we can see that again, bullying and verbal abuse are quite high, and they are strongly statistically significant for both cases at 1% level. So yes, I will hand over to Shereen for some final key points and conclusion. Thank you.
Thank you, Eirini, very much, and thanks everybody. And just a word about why we included abuse, because when we did our pulse survey back in the summer, not this summer, the summer before, we didn't include information about experiencing abuse. But when we discussed the findings in the interviews with stakeholders, they pointed to us that actually there has been not only the well-being and workload, there has been an increased incidence of abuse, of different types of abuse, being called names. So we included it to kind of test the water, basically, and we were very surprised that this came up extremely strongly. So just a summary, that of course, we have to remember and realize that we're starting with a sector that already had been facing huge pressures prior to the pandemic. And when the pandemic started, the implication on the workforce were extraordinary. The pressures on them and how they were kind of neglected and the workload were considerable. It's really worrying, the findings related to abuse, not only about the well-being and how their work has made them feel gloomy and kind of depressed, but really to be facing, kind of facing these issues. Ethnicity and nationality is again worrying, the relationship and differentiations. So we've seen some differences with our initial pulse survey, but we were not able to statistically test this because of the small numbers. But now we have the numbers, and unfortunately, and that links to perhaps a huge volume of research to do with racialized workers and how they actually take some of the worst part. The differences in terms of setting actually reflects what has been happening. So care home staff was faced with and bombarded with contradicting guidance. They were facing families that they wanted to visit, but they almost like the gatekeeper, they will portray it as the bad people, that they are preventing them to seeing their families. And they were taken, all the frustration, a lot of it, I wouldn't say all, was taken on the staff. And also when residents don't see their loved ones, they become challenging and frustrated themselves. And clearly there were not support mechanism in place to counter this effect. The workload pressure continues to increase. There was not matched pay. So we've seen even people who have to self-isolate, only less than half of them were paid the normal pay. A lot of them were not paid enough money at all. Some of them were not paid entirely. And we've seen the significant impact on workers' health and well-being. We didn't show the results. We didn't show how much the impact. A lot of them said that the general health had deteriorated, but our focus today was in the relationship between abuse and health. And obviously there was a clear link between being subjected to any form of abuse and the well-being, and obviously the intention to quit. This intention to quit, particularly to quit the whole sector altogether, are again, very worrying. We just seen this morning some figures coming out from new data showing the shortages and the deficits that have been happening in different settings in the care sector since the pandemic. And that is considered, that's significant, because when you start already with something like 30% turnover rates in some areas, that's a huge problem. So in terms of the kind of wider implications, the feeling of being neglected and undervalued is cemented really by the experience during COVID. The workload, the job satisfaction, sense of responsibility. But what's interesting that not everyone is saying I'm going to leave, but actually some people saying I'm satisfied with my work, and that links back to the motivations of a lot of people joining in the sector. But the implication on their well-being is quite huge if we not only looking at the physical, but the mental and financial well-being. A lot of people don't talk about the financial well-being, but it's a very crucial element of all our well-being. And that would lead to really further retention issues, a kind of exhaustion and burnout, and the ability of the sector to maintain a kind of right standards, and also the relationship, to build a relationship with care workers. Other things we didn't talk about, of course, is the combined effect of Brexit and COVID-19. And now what's going to happen to the nature and structure of social care? We know that we've got migrant workers, usually around 20% of the workforce. In the last decade, the majority were coming from EU. Now there is no mechanisms to do that, and no mechanisms to come through other, kind of visa routes because of the very low pay. Who's going to fill the gap? And a lot of questions around the grey economy, undocumented work. And the other question, of course, relates to what happened in home care, in care homes, and the idea that live-in care might be coming to substitute, but then another set of questions about regulations and, who's going to provide this live-in care. And that brings in the discussion, the kind of sector-wide changes. We are waiting for the reforms. We need to talk about better pay, not only about better pay, but about better jobs, about supportive jobs, about jobs that can maintain the well-being of people, and to increase the pool of recruitment. We've seen some geographical disparities, and the question that, of course, we didn't answer during this project is the impact on users and their informal carers. This is, of course, it's like a triangle. One affects the other, so they don't act in absence. And the big question in well-being, the well-being of everybody, the well-being of the sector, its ability to perform, well-being of workers, and well-being of people using the services, and the informal carers. And that's it for us. We provided some links to previous reports. You will find the report on the Pulse survey. You will find some presentation, and we are writing an academic paper. And hopefully you will be able to report on the next wave. And as I said, do please retweet and spread the word so we can get a higher number of responses to our second wave of the longitudinal study. So thank you from us, and any question, we've got just a couple of minutes.
Thank you very much. Congratulations. And it's amazing how you've been pivoting your research, again, like we have seen a few examples today, to match the situation, but also to match the type of findings you are getting, and then translated that into capturing properly a phenomenon that was clearly emerging, and it's very well done. Is there any quick question for Eirini and Shereen before we move to the next paper? And I see Daisy has already put the links on the box, and yeah, Julian.
I'm going to just throw this up as a consideration. As you know, I'm going to come at this from two areas so I can cover the spectrum. One is an operator, a board member of a long-term care institution that's not for profit. The other is I'll say an experienced caregiver going back probably to the 60s, 65, maybe 70s. I'll start there. I looked at the indicators. It's a great slide presentation, but it made me think. It made me think of when you're speaking to the workforce, and you're speaking to the challenges, and you're using the indicators, the intention to quit, all of those areas. I find that fascinating, how you're doing that. What I'm going to suggest or to consider, why isn't that equally being done for caregivers? Because really, when you think about it, until somebody actually qualifies it, and there's a continuum of thought, I'll put it, that caregivers actually are part of the workforce. The only difference being is they're unpaid for the most part. And significantly, when you look at the numbers, they out the value, and I used the figures yesterday of 65 billion in Canada. That number can be qualified by researching the University of Alberta, Dr. Janet Fast, who I've spoken to a few times, Shereen Anderson. And when I looked at the indicators, I'm saying, well, these apply to caregivers. I wish I had an intention to quit.
Yeah.
So health and well-being, let me assure you, I've never used the term stress in my life up until I became this last time a caregiver again, and or trauma, and or PTSD. When I gave testimony back months ago at the Long-Term Care Commission, I admitted at that point, I says, I think I have some of these things. And that was hard for me to say, because I grew up in a world of you didn't admit those type of things. But all the factors, I just, again, for your consideration, because you are thought leaders and you can make a difference. But I just wish, and I suggest, that the equal amount of time you're putting on workers, which is true from an operator perspective, we see what's the impact on paid caregivers are. I wish that sort of research would be focused and really focused on the value caregivers bring. And I think, again, yesterday I may have said, imagine long-term care without them. If they all pulled out tomorrow, we went on strike.
Yeah, well, I can't agree with you more, Julian. And I think it's in Europe, it's estimated that 80% of long-term care is provided informally, unpaid. I just want to assure you, I know Janet Fast, we work together, and we actually just been awarded a Centre for Care led by the University of Sheffield. And part of our work will be completely focused on unpaid carers. We're going to put together a national survey exactly asking these questions in the UK about not intention to quit, because they wouldn't see it this way, but a similar way,
yeah.
You know, so the care burden and the unmet needs and the well-being. So it is definitely something in our radar, and it's something that cannot be disintegrated from the bigger picture. So I think the issue is that, as you say, informal caregivers, they are put in that situation. A lot of them haven't been by choice, but a lot of them would choose to do so because they're loved ones, and there is huge stress and burnout and costs to the economy. But when you work, when you are employed,
Right.
You expect to be paid and you expect to be treated in a certain way through that kind of working environment. And what we see with the workforce, that these sometimes are blurred, and they are treated in a lot of ways like informal caregivers. So it's a really interesting and important element. I don't want to take on from the next presentation, but really it's, we can talk about that for hours, but just let me assure you that this is something that is not escaping our mind.
Well, I don't mean to indicate that. I mean, I come from a union background, so I understand what's happening. So I'm a huge advocate for both the stratification of job profiles, how that's the hierarchy within it, and who's actually doing the majority of on-hands work, which are, in our case in Canada, it's PSWs. And And sadly, they're not given the recognition. What I'm saying is it's just, it comes to a point where I'm glad you're talking to Janet Fast, because in Alberta, one thing they have is they get right to the point. I use 2-syllable words at most. I try to stick with 1-syllable words, but they get to the point, and I'm glad you're doing it. I commend all of you for what you're doing. I just wanted to raise that as a flag, I guess. I'll keep it simple.
Thank you very much. And that was a very important conversation. It shows the importance of taking a systems approach to this. And of course, the in-depth research also needs to sometimes go more in depth into one or the other. And this morning we did have some sessions. I know that was a very bad time for our Canadian friends, but we did
I
have
like
a
using,
session.
I'll grab some of your 4-syllable words so I can fit in once in a while, but I'll usually stick to 1 and 2. Thank you.
Yeah. But we will share the videos also from this morning, looking at some of the impacts on carers, particularly of people with dementia. So we have covered it, but just at the bad time in the day also for Canada.